And we are live. Hello, everybody. Welcome to our Straight Up Strong monthly interview conversation. I'm Michelle Farrell, one of the coaches and founders of Straight Up Strong, here with Tina Tang, my amazing partner, and Dr. Mel, who we're so excited to have today.
Thank you guys for having me. I'm excited too to talk to you guys.
Great. So why don't we start with you just giving a little intro, who you are, what you do.
Yeah. So I'm Dr. Mel. I'm a physical therapist. I have been working in orthopedics for 5 years. And then in the last 2 years, I actually did added on my specialty of pelvic health. But I've always worked with children to seniors, like my oldest patient I think was 105. So I definitely have experience all through the gamut, and I love working actually less. It's funny, I working less with athletes, but just because I think athletes are just so amazing at their body. My goal is to like really educate more people who are not so familiar and in tune with their body. But I still work with athletes too. It's not like I don't like I became an athlete late in my life too. I actually become an athlete until my late 20s to 30s. So now I do have a new love for working with athletes. But really, I also have been doing yoga also. I was a yoga teacher for wow, it's been like 8 years now that I've been doing yoga and teaching yoga, and I've been also working with doing a lot of prenatal yoga too. And I also teach and train yoga teachers in anatomy because that's just my passion. I love learning about body parts. I love naming where everything originates and inserts, and I love knowing the function and all of that. So that's essentially me in a nutshell. I also now have a little boy, so I'm a new mom. And so thank you. Trying to juggle all of that now. So I'm trying to juggle career, momhood. My husband's currently deployed, so trying to juggle all of life together is essentially what's been going on now.
Wow. Wow, you are Superwoman. I can't even imagine trying to juggle all of those things at the same time. Wow. What is the difference that you would do for a prenatal yoga class that would be different from just a regular come to yoga class?
Sure. A lot of more props when you're doing a prenatal yoga class. You're really ensuring that the mom is doing proper breathing mechanics and proper core engagement. Because the big thing with prenatal yoga, and with anyone who's pregnant, you want to make sure that they're not creating any sort of doming within the belly, because that can lead to increase in diastasis recti. It's a splitting of the abdomen. And also, you just want to make sure that they're not also, moving beyond their normal range, right? Because we have a lot of, there's hormones raging through our bodies when we're pregnant. So that makes us sometimes a little bit more flexible than normal. And so now a mom might be, trying to stretch her arm a lot further back than that she's normally used to, and that could just lead to a little just more injury and pain. So just things like that.
Now, I have a question that probably happens a lot at the gym. So let's say, and it's great to have a physical therapist to tell you ice, no ice, that kind of thing. So if someone's at the gym and then, because this happens, someone might feel that they pulled something or something starts, they might have pulled whether in their back or their hip, and they're starting to feel things tighten up. When they go home, what's the first thing they should be doing? Is it ice or heat or, that kind of stuff?
So essentially, when someone feels like they've pulled something, I actually don't recommend either. I say go home and move and see what feels good for you. So especially when it comes, and we're going to talk a little bit more about this in the future in our presentation, but you want to see what movement, which direction feels good for you. So for, let's say for the back, if it hurts to flex forward, any motion that forces you to flex forward, or that requires you to flex forward, avoid it for that moment. Do everything backwards, and then vice versa, right? Ice and heat is good if you're really just having a really hard time with movement. So if you can't seem to find any directional preference, you can't bend forward, you can't extend, or you just have this just big fear. And we're going to talk a lot about how fear really influences our pain and how stress really influences our pain. But if you really can't get to that point, see which works for you. Usually when it's an acute thing like that and you're really just feeling a lot of pain and a lot of fear with that pain, go ahead, throw an ice pack in. What's going to happen is it's going to numb the area, and it's going to help kind of bring that nervous system down, and you're going to feel a little bit more comfortable. If you're feeling a lot of stiffness and it's just hard to move because it's tight, go ahead, throw the heat pack on, because that's going to cause just some heat into the area. And just kind of tell your brain, okay, let's relax, and let's reintroduce movement after that. Because essentially a heat pack and an ice pack actually does not go that deep to the muscle, like down to the muscle level that we need it to go. So a lot of people think that if they just throw a hot pack on, it'll really soften that muscle and loosen it up. It really can't go that deep. It only goes about a few inches, like an inch at most. But for the really deep stuff, deep muscles in our back, it's not going to get there. So really the thing that's going to actually help get that nervous system down and the pain down is to really get some movement in.
That's helpful, because I think people never know what do I do when I go home? You know, if they ever feel like they did something, or something starts to feel like it was injured. Did you have one more question, Michelle? I wanted you to talk a little bit more about the mental aspect, like the fear. That's interesting.
Yeah. So definitely. So when we actually have pain, the interesting part is the area that it's processed in our brain is our limbic system. Our limbic system is where we also process emotion. So that whole area is where we're processing stress and we're processing pain. And when we're experiencing things like pain or any sort of other emotion, our body and our mind has to kind of create a list of priorities of what we're going to feel and how we're going to perceive it. So if we're having a lot of stress and we're fearful of the movement, then that movement is going to be we're going to be a lot more sensitive to movement, and our brain is going to prioritize that, and we're going to feel it even more significant, right? But let's say, so for example, I sprained my ankle last week. I just said, okay, I sprained it. I'm just going to do some exercises. I still went to the gym every day. I think I went 4 days in a row. Even tried running on it. That was not smart. But I created that in my brain where it was just not a high priority, right? And so essentially what ends up happening is you just don't feel it that much, right? You know, if you're really busy, you're like, oh, I didn't even realize that my back was hurting. I was really, busy and doing a lot of things, right? Because your brain has created that as the lowest on your priority. Same things if you sprain your ankle and it really, really hurts, but now there's a school bus coming at you, right? You have to run across the street so that school bus doesn't hit you again. So then your brain then creates that priority and bringing it down. Other things that are going to increase that sensitivity of pain is if we always think about that glass half full, glass half empty type of analogy, right? What happens if that glass is overfilled, right? So first we have our glass and we pour it in because now we're feeling a little pain. We also now have a deadline of work. We're going to fill it a little bit more. And we keep filling that glass with different stresses within our life. And then suddenly that glass becomes overfilled. and then we're feeling all the sensitivity that's kind of happening. And so if you can kind of get that glass to be a little bit more balanced, then we're going to feel a lot less sensitivity to the pain, and then perceive it and be able to move a little bit more freely.
So that just made me think of like, you know, how little kids, when they hurt themselves, and be like,
Yeah.
you just it's not a big deal.
Yeah,
so here's
absolutely.
the thing I do see at the gym, and I'm curious on your thoughts. So someone who's active in the gym and then they like tweak their shoulder or do whatever, will continue working out. At what point? And then, because somewhere in the thought, and I think for some people the pain goes away, like eventually, like whatever, the body works itself out. What are some cues, like, oh, this is something you have to get looked at, and you can't just ignore it?
Yeah. So if your form completely fails, right, that's a first one. So let's say you're doing an overhead press and you suddenly feel like a sharp twinge in your shoulder. You keep doing it, and you're noticing, or your trainer's noticing, you're not locking out that shoulder, or it's starting to round forward because you're avoiding it. And if there's no way that you can correct that form because it hurts too much, that's when you need to really step it back. If you also continue to do the exercise, now that pain is increasing, right? That is 100% stop. You know, if you're doing it, it either stays the same level or kind of relaxes down, then great, you know, keep going. That means that exercise is good for you. You just need to kind of work it out. But really, once it starts getting to the sharp pain, you're avoiding it, you're starting to grit your teeth, your face is starting to change, then you really need to back off. And the big thing also with is if you can't put any weight onto that shoulder or into the leg. So if you find that you're limping, you can't walk, and you can't put any weight onto that foot, knee, or shoulder, hip, whatever, or your back, then that's a red flag. Stop the exercise. You need some help.
Oh, that's really, really helpful information, because I know that a lot of people, there's that saying that we hear so often, like, no pain, no gain, right? And like that, I think really more refers to like discomfort, like in order, if you're trying to gain muscle or you're trying to get stronger, you're going to have to push yourself out of your comfort zone a bit.
Right.
But to actually feel like a sharp pain, to like your body and your nervous system are saying, like, whoa.
Right. Pain is a signal for change, right? And so that change could mean either dropping the weight down, changing the movement, modifying somehow, or maybe that change is literally just like, let's calm it down, let me fix my breathing, right? But pain is not something to be fearful of, but something that we need to respect for sure. And we need to listen to our bodies and figure out what that pain and that change is. And that's why a physical therapist or a doctor or someone trained can actually really help you figure that out if somehow you're not fit, you can't figure out that yourself too.
I just thought of a very common question that happens, especially when people get older. They're like, when people hear noises, let's say there's no pain. You're like, oh, whenever I do this, my knee crackles, or my blah, blah, blah crackles. What is your advice with people when they hear noises in their body?
Yeah. So when you hear noises, so I get this all the time, like, oh, my knee cracks, or my shoulder pops a little bit. The big thing, is it painful, right? So that we always ask, well, is it a painful pop? Is it a painful movement? Is it a painful like click? You get clicking a lot. If it's not painful, unfortunately, it's just kind of your body just making noises, right? A lot of times if you hear a popping sound within the joint, it usually is just gas bubbles that's been built up within the area. If you feel like a clicking, sometimes it is just like maybe like your tendon's just a little, your muscle's a little tight, causing that tendon to click over a bony prominence. As we get older, the surface of our joints are no longer as smooth as they were. So there's a little bit more friction that's being caused within the joint. You're going to be hearing a little bit more. So again, if it's painful, then yes, let's figure it out. Maybe we can change that. But if it's not, then just keep going and make sure that you're just moving comfortably.
I love your tip there because that's what I've heard. I remember another therapist, but whenever I say, I just want to make sure people are like, so if everyone's body has noises, but it's pain is an indicator of that's when something is wrong. Okay.
Exactly.
And I thought of another question people have, especially if they're kind of self-diagnosing, when they pull something or feel an injury, what's the best advice for when you're ready to go back? Like how much longer after the irritation or the whatever goes away is advisable?
So pretty much, I mean, it always depends on the extent of the injury. Was there a wound involved? All of that. Let's say you have a basic strain or you're recovering just from like a basic injury. Essentially is, can you modify whatever movements that cause that pain or cause that injury so that you're not feeling that much discomfort, or you're barely, or you're not feeling any discomfort at all? And then can you slowly load it back up, right? And once you start to slowly load it back up, then and you're still feeling good, that's when you know that you can start to return back to your normal routine, right? I think as an athlete, I think when we went to PT school, I remember the big thing was, oh, if it hurts, make sure the athlete does not do it. Take them make sure that they're completely pain-free before you put them back into the game. That does not work for athletes, and that doesn't, like, I sprained my ankle. I went back to lifting and trying to run. Essentially, it's really, again, just returning back to that idea of let's respect the pain, right? So if you can relax your face, if you can keep good form, if your pain isn't elevating as you're doing it, go ahead and try to return back to whatever sport or movement you're trying to get to.
Yeah, that was awesome. Michelle, sorry.
That's okay. I was just going to say, I am so excited for our workshop on the 20th when we're going to really be able to dive into all of these different facets of pain. Like, I'm really interested in that, how our body senses and processes pain, that connection to fear and stress that you were just talking about, and giving those real actionable activities and things that folks will be able to implement so that they can be very in control of themselves, like their bodies and their bodies. So I'm really excited. So if you are tuning in or you are watching the recording of this, make sure you use the link down below to register. All the details at that link. The workshop is on Saturday, March 20th at noon Eastern Standard Time. It's going to be amazing. I'm so excited. So
I know, I can't wait. Oh, and then Dr. Mel, you want to just tell them what your Instagram is in case anyone's popping in and they want to find you?
Oh, yeah. My Instagram is bestselfwellness.pt on Instagram. So yeah, follow me.
Excellent. We can't wait to see you next Saturday on Zoomies.
I'm so excited. Thanks, guys.